Hi all, I'm Dr. Neema Bhat. I'm a pediatric oncologist. So I'd like to talk about symptoms and signs of brain tumors. How do you watch, especially in children? So the most common cancer in pediatrics or children is brain tumors. This is not a very well-known fact because it tends to not be picked up at the right time and the awareness is not as much. Brain tumors, how do you pick it up in children? As we know, children are not able to verbalize, Mama, I have pain here, I'm not able to walk here. They're usually not great at discussing their symptoms, unlike adults who are more aware of what's going on. So, as a parent, what are the symptoms you have to watch out in your little one to see or to be aware if they might have a brain tumor? Number one, incessant vomiting. So, vomiting that happens first thing when they wake up in the morning, and it keeps on, repeatedly vomiting throughout the day. Children complaining of headaches. Children hardly ever complain of headaches because all the factors that we face, stress as adults, children don't face that. So when children complain of headaches, take it seriously. If there is weight loss, so they're not gaining weight in spite of having a good diet, that's one of the reasons. If they're not doing well in school, say it's a child who's been doing well throughout up until their second grade, third grade, and suddenly their performance drops. They say they're not able to see the blackboard. They complain of any blurry vision. If there is a change in gait, so the way they walk, if they falter when they walk, if there is a stutter in their speech, so well speaking child but suddenly starts missing words or stuttering or stammering, make sure to get it checked out by a neurologist. One of the other things is a change in handwriting of the child, so make sure to watch the way the child writes and the way they operate their systems. So if there is a subtle change in their handwriting, that may be one of the early windows into this child probably having a brain tumor. And of course, one of the other symptoms is seizures. So if there is fits or seizures, then that can be one of the presenting symptoms of a brain tumor. Pediatric brain tumors are very treatable. They require surgery, radiation, followed possibly sometimes by chemotherapy and also transplant. But the key thing to be treated appropriately is to be picked up at the right time. So be an advocate for your child and make sure to watch the symptoms so brain tumors can be picked up at the right time and can be appropriately treated. Thank you.